Thank you, Mark. Could I just get a high sign from Sasha that you can hear me?
Yes.
Okay, great. Hang on one second here. Well, good afternoon, everyone. Thank you so much for joining us. And first and foremost, let me thank you for your commitment to the many people that you serve in your properties and in your communities. What I really want to share with you for just a few minutes before Emily gets into the meat of all of this is that this is a big priority for the Baker-Polito administration. And we are one of the only states, and perhaps the only state, I'm not entirely sure, but if we are not alone, we are in very small company. There are very few states that have prioritized residents of senior housing in their vaccine rollout. And we did that because we know the risk that these people are at clinically, and we also know that they have also experienced extreme levels of isolation from the rest of their community, their friends, their families, their loved ones. And we really feel it's important to get them into the vaccine rollout as quickly as possible and in a way that minimizes their need to juggle complex logistics of getting to and from locations that may not be familiar to them or that may pose challenges if they have a physical disability, a vision or hearing impairment, et cetera. So thank you all for being willing to do this. I do want to say at the outset that I know there's been a good amount of confusion about when this all gets started. And as Mark said, it will get started in a few weeks. We are very dependent on vaccine supply. And if you've heard the governor talk about this, you've heard that there are many more people to be vaccinated in phase 1 than we actually have vaccine for. And so as the supply evens out, we will roll through to the other steps in phase 2, which includes senior housing, along with individuals 65 years and older, and those who have 2 or more complex underlying conditions that may impact their risks for contracting and surviving COVID-19. So we are really anxious to work with all of you as you do this. As Mark said, there's a fair amount of planning. And so if there's 2 or 3 weeks of planning, we want you to be best positioned to start that planning now so that the minute this rolls out, we can hit the go button and get you folks all started. I also just want to acknowledge that I'm with a few other colleagues today from the Executive Office of Health and Human Services. Rob McLaughlin, who is with the Executive Office of Health and Human Services and works with legislative and other elected officials. And our colleague, Jana Ferguson from the Department of Public Health will be joining us shortly. She works directly with all the local boards of health. So she works with many of the people that you work with and has that perspective from that side of the work that we're all doing. So let me not take up any more time and let me thank you again for joining us and turn it over to Emily.
Thanks, Robin, and thanks, Mark, and the folks at MAPC for having me, and for you all for listening on this snowy day. Before diving into the meat of this, actually go back a slide or two, please. Before diving into the meat of this, I actually want to issue an apology ahead of time. I do have, like many of you, a pandemic puppy. She may make an appearance or 2 on screen, and you may see me open or shut the door. So I do think it's the one upside to the pandemic has made everybody very human and very appreciative and understanding of those things. So I just wanted to give you a heads up. Some people like to count how many times I open or shut the door during 1 hour. As Robin mentioned, residents and staff of low-income and affordable senior housing has been called out by the administration. And as you can see from this slide here, it is technically in group 2 of phase 2. So we're in group 1 of phase 1 right now, which is individuals age 75 and older. Many of those people live in low-income and affordable senior housing, and they would be eligible to get vaccinated right now. What we're talking about is if you wanted to take a whole building and do a clinic for the staff and for anyone who lives here, regardless of their age, you can start doing that in group 2 of phase 2. I do not have a crystal ball and do not know when that's going to be activated. We have been told to say later in February, but as we're in February, we move through it. People start saying, "Are we at later yet?" I do not know. I'm sure that will be a question, and fortunately or unfortunately, the governor doesn't check with me on those things, so I'm not knowledgeable. But what I will tell you is a little bit more about, as Mark said, this initiative, and also what you can be doing as a municipality now, how you can be planning, how you can be coordinating, and how you can be helpful. Next slide, please. So let's talk about what this definition is. What is considered public and private low income and affordable housing? Well, first of all, it's what's called age restricted, meaning in order to live there, you must be a certain age or more. Noting, of course, that many of those properties that are for people 60 and older or 62 and older often also allow non-elderly disabled people in the building, which is totally fine. So this would include rental housing that is operated or by local housing authorities as public housing properties, or also if they own properties that are age restricted and subsidized, but managed by a private company. It would also include those senior affordable housing properties in your community that are privately owned by an agency but received funding from the state or federal government in order to make that housing affordable. Again, it must be age restricted, and it can't be an assisted living or what's known as a continuing care retirement community or something like that was licensed or certified by the state. And the reason for that is that we have actually already vaccinated those folks. So you don't need to worry about them. But we're going to start with this universe of public and private low income and affordable housing. Now, there's no list that exists. I like to say I have some sort of a list. It's probably 95% accurate. And I'm happy to, if somebody wants to reach out to me to say, this is what I have, but you might know of another building. If you're in doubt at all, I'm going to give you an email, and I'll give it to you later as well, which is seniorhousingvaccine@mass.gov. Maybe Sasha or somebody could, or Elise could put that in the chat. Seniorhousingvaccine@mass.gov. And you can reach out and say, is this something that would be part, is this building that might be part of this? What I will say, however, is that if you ask the owner or the manager of that property and put this definition in front of them, they will be able to tell you whether or not they are considered to be senior public or private low income and affordable housing. Next slide, please. When we say residents, we mean anybody living there. So anybody of any age, with a small caveat that if you are a minor, depending on the vaccine that is being used, you may have some eligibility criteria. For example, one vaccine is only for people 16 and up, and one vaccine is only for people 18 and up. So there is that caveat. But it can include people who are not older adults, but are living in the building with the older adults, and that's fine. And as far as staff goes, it includes everybody who is paid or unpaid, working or volunteering at the site who have potential for exposure. So that includes if you have a board member who works the front desk once a week, and volunteering, that's totally fine. If you have people regularly coming into the property, that's who we're trying to make sure are vaccinated. We do have a website that I think either got sent to you already or will be sent to you after this. And we have a frequently asked questions document on there. And I would just encourage you, if you have questions about eligibility, you can obviously email me, but you can also look at the frequently asked questions document. Next slide. So Mark mentioned this, and I think this was it was a little confusing to folks. So back in December, we started with a federal program that was organized by the CDC, the Centers for Disease Control, called the Federal Pharmacy Partnership Program, or FPPP. And this was for long-term care facilities. In fact, it says everywhere long-term care facilities. So it included going and doing vaccine clinics on site in nursing facilities, rest homes, assisted living, continuing care retirement communities. And then somewhere in January, we discovered that it also includes some senior affordable housing, which is specifically funded through the HUD Section 202 Supportive Housing for the Elderly program. It was surprising to us, and we're not quite sure how it got in there, but we were happy to hear that this allowed for CVS or Walgreens to go out and do clinics. These are still ongoing right now. Per the CDC, other low-income housing was not included in the FPPP, only had Section 202, and those clinics began in early January, and that will continue into February, March, and probably April as we move along. We have folks from the state agencies of Mass Housing and CDAC have been reaching out to those properties and trying to help them through the experience. And I will say that we've learned a lot about this idea of an on-site vaccination clinic. What is needed? What is the heavy lifts? Where are the partnerships? What are the nuts and bolts of how to do one? And we've been trying to leverage that information in this work stream. But it is confusing. There were about 275 HUD 202 properties that are part of this program. And you see there's a link on the website if you want to see which ones in your community. They are not public housing, they are private housing. And what it meant is that there was suddenly some building, like you may have some building getting a clinic tomorrow from CVS and Walgreens, and the people next door who are in public housing are saying, what about us? Right. So it's made it definitely inconsistent and weird implementation. I will say, it kind of wasn't something that we had control of, and that we were pleased to see that CVS and Walgreens included these, but we recognize that there are about 1,000 more properties out there that were not included. And so we're going to try and get those, learn from what we learned from FPPP and help you guys get clinics or other ways to get vaccinated for the other 1,000 or so properties. Next slide, please. So for those properties, those 275 are in the federal pharmacy FPPP program, great, but what about the remainder? So for those, we're starting working now. We had a big webinar on the 28th, which seems like forever ago, but I think it was only a week and a half. We've been talking to boards of health. We've been talking to housing authorities. We've been talking to you all to try and get the word out there about the fact, like, here's what you can do. Here are your options. Here are some resources. If you want to move forward in X direction, we can help you find a partner. If you want to do this, we can help you with vaccines, and just generally troubleshooting and supporting you all. Next slide, please. So I don't know, Robin, do you happen to know if Jana Ferguson has joined the call? Because if not, I'll keep going and we can, once she's on.
I believe
She has.
Great.
She has, Emily.
So I think before I go a little further, we're actually going to hear a few minutes from Jana about what specifically she's been doing with the Board of Health and what the vaccine process looks like for them, because what I'm designing is different. So I want to make sure we see them as two complementary but distinct work streams. So Jana, I'm going to hand it over to you, if that's okay.
Sure, of course. And thank you very much for inviting me here today. And I'm happy to speak to you about this. So the health departments really started getting involved in vaccine administration as part of the first responder group that began in just the second week of January. And some have continued to work in their community to get vaccine. Some have partnered with congregate care sites and shelters, for example, but a lot of the work that the local health departments have done, either with, alone, individually, or in regional collaborations, have been kind of a little more broad about the people who are eligible for vaccine through those communities. So perhaps they've served everybody that is currently eligible to be vaccinated. So there's an allocation process for everyone. The health departments receive vaccine when the supply is available, to make sure that they can run these public clinics. And in some cases, they're also working to meet some needs in their community in like a more private clinic setup, like the first responders. And I think that when we talk about the partnerships between the health departments and senior low-income and affordable housing, we're really talking about a complementary process, but not the same process. And I know that isn't a lot of detail, but I know there are health departments on the phone that's very familiar with it. And I think what's most important is how we can help support your work when you are partnering with the health departments in your community to make sure that your residents are vaccinated. So Emily, I don't know, I think we want to go into that, and then we can answer questions after. It may be helpful if those come in.
I think that's great. No, that was perfect, Jana. Thank you so much. We actually emailed Jana like at 9 a.m. this morning and said, can you say a few words? So good job.
Thank you.
So let me talk a little bit more about the senior affordable housing. Next slide, please. What we have said is here are sort of your options, right? I am an owner or property manager of senior affordable housing. I meet that definition I showed before. You can make friends with a pharmacy who does your flu clinics, the local hospital, the community health center, any medical practice that's sort of in your community, and say, hey, would you come here and do an on-site clinic? You may say, you know what, this space is not good for an on-site clinic and social distancing, but maybe we can use a different space. The library's been shut down. Maybe we can see about using that. Or you could say even, can we bring them to your store, which is across the street, and we will have like an off-site clinic, the special hour, you'll open an hour earlier or 2 hours earlier, a couple of days, and we'll bring our residents over there. So that's one option. Another option is contacting your local board of health. As you heard from Janice, some of them are involved in clinics. They may or may not have the capacity to take this on. And they, so that would be obviously the one of the places to ask and to see. I did this call on the 28th, and by that evening, I had already heard that every housing authority in the state had called their local board of health, which is great. And that's one of the places, but I want you to know you have multiple options. Some local board of health are doing a lot right now, and this may not be something they have the capacity to do. Or the third is that there are other sites out there in the community where people are going and getting vaccinated, as you're well aware. Some are easier to get to than others. Some are more convenient than others, but just want to throw that out there as an option as well. These are not mutually exclusive, so you could also mix and match. If you are a building if you're a property manager and you have buildings across the state, you're a management company, you'd be using different approaches in different communities. You're going to see what works for your building and your community and your residents. But I think going into this, I thought this was going to be the lift. I thought that this was going to be so hard for people to find relationships. What I have heard is that, people went out and they started calling people, and you'll hear later, they have to tell us about that. We already have 168 clinics scheduled for over 100 properties where they've made these relationships. Also, I am getting, I'm a houser. I'm having more conversations with pharmacies and with supermarkets than I ever had before, who are dying to do this, right? I have a nice gentleman who owns an independent pharmacy with his brother. They own 4 pharmacies in the Metro West region. And he told me the other day, I don't care where it is in the state, I'll go, nice day trip. So it really is, there is a real willingness to be involved in this. So I don't want that to be a hurdle. If you are in a community and you're struggling to figure out what the right fit is, or you're saying my board of health just doesn't have capacity, drop me an email, send it to me, or send it to the senior housing vaccine at mass.gov. It's the same, comes to me anyways. And we will send you ideas, and we will send you ideas until we get one that sticks. So I have multiple people calling me matchmaker right now. I say I'm finding dance partners. Somebody called me a yenta. So I'm doing a lot of this and it's working great. So please do not suffer in silence. Please reach out. And it may be that, for example, I have heard from many private housing owners that are unaware that the housing authority is partnered with the city or the town to do with their board of health to do all of their housing, but they didn't consider the other buildings that were for senior affordable folks that were private, because that's not overseen in the same way. So as a municipality, as my audience, I would encourage you to think broadly, think beyond the just the public housing, think about the private senior affordable housing that's in your community as well, and try to include them in your efforts as well. Next slide. So there's been a lot of questions about who gets the vaccine, where's the vaccine? you know, as we heard, there's supply constraints. How does this all work? I will say, we haven't been activated yet, meaning the group 2, the senior affordable housing is yet to come. So I'm learning about the process that I have not been involved in. And every day I seem to learn a little bit more. So this could change, meaning my understanding of it is, but in general, we have told housers to go out there if you want to do a clinic, and find somebody who's a vaccinating agency, and we're happy to help. Do the clinic on site or at a mutually agreeable location. Any agency that agrees to partner with a senior affordable housing property to do this can request vaccine allocation to support these efforts. That was beyond what they normally get. So you heard from Jana that some boards of health are capped at, let's say, 100 vaccine doses a week. We would, if they were doing a clinic and they needed 300, they could get the 300. Now, there's a lot of caveats to that. So I want to make sure I'm not saying that every time they're going to get the 300. It depends on sort of the allocation requests that are coming in across the state. And it also depends on whether or not they have used what they have on hand. So there's a real push to make sure that when you ask for the vaccine and you get it, you have to use it within 10 days. So there's really a push to not have people sitting on doses. So if you are asking for more, it's because you need it and you don't have enough to do what you want to do. We're asking, if possible, that the vaccination agency be part of this program, which is the Mass COVID Vaccination Program, or MCVP, and they are responsible for asking DPH for the vaccine. It is not the houser, it is not the city manager, it is the agency that is in the MCVP, and they have a special PIN number, and they know how to ask DPH. There's a weekly survey. It goes in Tuesdays at 5 p.m. and they get if it's approved, they get the vaccine in hand Monday, Tuesday, Wednesday, or the following week. So as you think about your process and think about how this is, just think about the timing of today's Tuesday. Let's just use today. If we were able to do this now because the governor had activated, today is Tuesday the 9th. We would put in a request, and let's say I got the vaccine next Wednesday. It's just based on shipping and whatnot. And then I would have Wednesday, help me out here, the 17th. Did I do that right? And then you would have 10 days. So from the 17th to the 27th to hold your clinics. And then in the middle of that, your vaccinating partner may be requesting the next week for more things. So that's the sort of the layout of the process of how vaccine gets, sort of how a bill becomes a law, how vaccine gets into the hands of the people who need it. Again, these requests are not coming in from the housing agencies. They are coming in from the agency who will be putting the shots in people's arms. Okay. No requests. If you submit a request today, it will not be approved because we have not been activated by the governor yet. Group 2 of phase 2 has not been activated. So it will come to me as a senior affordable housing, and I'll say, sorry, I can't approve it because we haven't been activated yet. In addition to this survey to get the vaccine, the housing agency has to do their part too. Next slide. So actually, before you submit anything or worry about vaccines, as soon as you find your dance partner, we have told the housing agencies, you need to go online and fill out a survey. And you need to tell us who that dance partner is, what you're planning to do with them, including an estimated number of doses needed, whether or not that the doses are be Moderna or Pfizer, and information about your partner agency. That is how we use that information to both forecast the need for vaccine over the next 4 weeks, but also when the request comes to us from the XYZ Board of Health, we can say, oh, sure, I know all about that because I've already have this housing clinic, so I can go ahead and approve it. If the housing agencies don't submit this information and I know nothing about it, then when the request comes to me and I know nothing about it, it's not going to get approved. So there were 2 parts. One is, as soon as you find your dance partner, you fill out the planning survey. The housing agency fills out the planning survey. And 2, once we're activated, there is this survey that gets submitted weekly in order to get vaccine in hands of the vaccinating agencies. Next slide, please. Okay, you've gone ahead, you've done all that, everything's great, you're moving ahead. And in fact, as Mark said, you have all this time right now while you're waiting and people are like, what am I supposed to do? Well, there are a couple things. One is think about everything that needs to go into whether or not you want to have a clinic and how it works. So you've identified, somebody who can come, let's say on site, has to be at least 3 weeks apart because they have to come twice, right? 2 doses, either 3 or 4 weeks apart. You should be educating your residents, talking to them, drumming up business, right? We want to get as many people vaccinated as possible. And we want to dispel any myths. We want to educate them. So there are lots of materials online to do that. That can be, a whole campaign right now working on that. The partner that you have who's going to be vaccinating people has some paperwork. And so get that now, get their consent forms, find out if you need copies of insurance cards, whatever it may be, get it now and start working on it. If you have a building of 100 people, having them come to that clinic and do the paperwork then is not going to be a good idea. You really want to get the paperwork requirements now and start completing them. They might need to be translated into different languages, etc. You want to think about, for the housing agency, think about the adequate space. Do you have space for people to immunize? And then they have to sit for 15 minutes afterwards and be observed. And you have to maintain social distancing, right? And how do you not create a line of people waiting to come in? How do you do the scheduling, the logistics, the resident flow on the day of the clinics? What kind of volunteers might you need? What kind of staff might you need? And are there people where you're going to have to do something different because they might not be able to come to the lobby, for example? So thinking about the audience, next slide. And I just want to actually flag the FPPP experience has been great. And we have found out that you do need volunteers. You do need help for these clinics, whether it's just translators or whether it's people ushering people in or ushering people out, and call on your councils on aging, call on your aging service access point agencies. They have been really helpful in helping the clinics that have happened so far. How can you all help specifically? Reach out to all the senior affordable housing in your community, excuse me, the public housing and the private affordable housing. Ask them what they have planned. You'd be surprised, I think, because some folks, when Mark and I talk, he says, well, so-and-so community doesn't know what to do. And I say, well, really? Because I have a planning survey from them saying they're doing this. So maybe the left hand and the right hand just need to coordinate. So make sure you're all coordinating and moving in the same direction. Offer to help plan this, offer to help coordinate, offer to use town buildings. So it may not be the right space. There may not be a good enough lobby space, but if the library shut down or the senior center shut down and that is located nearby, that might be a better option for doing a clinic. If that's the case and it's off-site, talk to your council on aging, talk to your other local partners and see if there's a way to transport people in an easier way. Reach out to local healthcare agencies. You all have great voices with your local community health centers and your local hospitals. They don't know me from a hole in the wall, but they know you. And so if there is a partner, I would also check with them as well if you're needing a partner. Help the housing agency plan for the clinics by completing paperwork. Sometimes this is just like literally they need people to make copies, or they need people to go door to door and have consent forms completed, or they need people who speak different languages to do those things. They need volunteers. And then I think the last thing, it's not last because it's the least important. It actually should be reversed and put at the top, which is really making sure that people are encouraged to get vaccinated. They have spent all this time not going out, being isolated, and now often there is a fear of getting vaccinated. And whatever you can do to allay that fear and encourage people, that would be, if you, mayor or town manager, are calling them to encourage them, and you know them, that's going to be a lot more than if they got a random call from somebody else. So in conclusion, then we'll go to questions. Next slide, please. This is our website. It has resources and templates and sample documents. It's got recordings from previous webinars that we've done similar to this. It links to other useful information. And it has just where we kind of keep things up to date. Next slide, please. I think this is the biggest thing. I want you to walk away with an email address. Feel free to email it. Again, it comes to me. It just keeps my inbox a little cleaner. And we are happy to help in any way, whether it's making partners, whether it's thinking things through, whether you said, you know, hey, is something going on in my community? Has anybody submitted a planning survey? Who you mentioned some partners who want to help. Do you have an idea? So I will, it's not just me. I'm working with the Department of Housing and Community Development. I'm working with Mass Housing. I'm working with CDAC. Together, we are problem solving. So I want to just let you know that we're very available to you and very excited to, I know everybody's excited to start this work. So with that, I think I'm done talking at you. I don't know if there are questions, Mark, or what?
Yes. Yeah. Hi, this is Mark Fine from MAPC. So thank you to everyone who's been able to put questions in the chat. I'll start to use some of those in reading those out. But for others who want to ask questions, please feel free to direct message me in the chat as well, and I'll try to get those asked too. So Emily, you mentioned kind of pairing up and finding a dance partner. And in many cases, it sounds like that has been successful for a number of housing sites. But we did have a question, from Ann Conley, who is with an apartment, an independent low-income subsidized senior site in Falmouth, Massachusetts. And they've had, they have 83 units and 86 senior residents, many who are not computer literate. And they've been trying to schedule a clinic or partner with an entity, but they've been told like no one has the vaccine. It's been very frustrating. And even in Barnstable County, where they've done some larger clinics, I think at their regional hospital for like 1,000 doses, those get booked up really fast. So they've been pretty frustrated about not being able to find an appropriate dance partner. So I don't know if you, Emily or Jana or Robin, who could maybe speak to that, because maybe they need help finding a dance partner.
Sure, I'll start and then maybe Jana or Robin have something to add. I just want to clarify kind of the vaccine allocation. So right now, anybody who's 75 or older in phase 1 can go ahead and take advantage, as you said, Mark, on the Cape, of Barnstable Housing or Barnstable Healthcare, or other things where you have to go online and sign up and try and get a vaccine. What I am talking about is actually not that. What I'm talking about is finding a dance partner who you will ask to, let's say, come to your building and vaccinate everybody on site. It is much more efficient and effective to bring the one vaccinator to the 100 than the 100 to the one. And we recognize that, and we recognize the frailty of folks living in this housing. We cannot do that right now because we have not been activated by the governor. Once the governor does activate the next phase, which includes 65 and up, 2 or more comorbidities, and senior affordable housing, then you will be able to request vaccine. All those people who said, I don't have vaccine, can request vaccine as part of the senior affordable housing allocation. I have my own little pot. Now, that pot, is subject to a whole bunch of things, and it may be that I say, yes, this sounds great, but do it next week. But it's not going to be the same conversation. So I don't know, Jana or Robin, if you wanted to add to that. And I'm happy to help you find a partner. I already thought of a few in my head.
I think that's great. I mean, that is the thing. We have our, each of these priority groups and different channels to get vaccine, like hospitals have their own pot, and pharmacies have their own pot, and the municipalities have a pot. And so when this activates, the partners will be able to work together in order to make sure that this low income and senior and affordable senior housing group is able to access those vaccines that have been set aside for this work.
So I thanks, Jana. I just want to reiterate, when you talk to the partners, they'll say, I think it depends on how you ask the question, right? They'll say, oh, I don't have any vaccine now. That's not what you're asking. What you're saying is, in a couple of weeks, once we're able to, would you be willing to request vaccines and come to a clinic on our site there will be a special pot of vaccine for it. The conversation won't be about vaccine allocation as much as it is, can you come to my building and do this for everybody on site?
Great, thanks, Emily. So we had a question also from Janelle Satterwhite. And she had heard some feedback from local boards of health that they can't guarantee the second dose. So that's been one of the reasons they've been kind of holding back from making a commitment to work with her residents. You know, and so she asks, is this something others have experienced? And if so, are there any suggestions?
Oh, Jana, I'm giving this one to you.
I am not sure why that statement is being made because the state is prioritizing second doses. And certainly that is being accounted for in this program.
Yes, all second dose requests will be prioritized over any first dose
That's correct.
request. As
It
they come in.
it may feel, because there's this confusion about the communication around when, you know, somebody is going to the health department asking if they can partner, you know, the health department is again thinking about the vaccine that they have available to them. And not every health department is able to count on vaccine each week. So there may be some concern about whether or not they'll have it, you know, at the time, but that is a different program. This is specifically set aside, and across the Commonwealth, we have been saying we are prioritizing the second doses over first doses. So that should never be an obstacle to getting a first dose.
Thanks, Jana. So another question we had from Lauren Buck, who's the Revere Public Health Director, asked if they have a building that is majority, you know, 75 plus, could they start earlier than phase 2 priority 2 with that building?
So yes, and in fact, some places are doing that. But what it has to be based on the vaccine that you have in hand, because or that you're able to access, because the pot that I have for senior affordable housing hasn't been made available yet. So you can go ahead and do that, but you'd have to have enough vaccine out of your own, your current ability to get the vaccine. But I know Fall River Housing Authority is doing it, and other places, I think Cambridge. Nothing's stopping you.
So I just want to make sure, though, this is Robin, I just want to make sure that this point is clear to people. If you're arranging something now, it's out of whatever existing allotment your partner has. They may have enough, but probably they don't. And what Emily is talking about is a separate stream of allocated vaccine, and that will get turned on when the governor activates this next phase. So don't be concerned if they say to you, we can't do this now, because we will have a separate allocation for senior housing once the governor activates that phase. Okay, so I know that's confusing. All vaccines are local. I know there are all kinds of different approaches and strategies in local communities, but don't be concerned if it is not working for you right now. It's just that your local partner needs this senior housing allocation to do it. You can say you understand that and you just want to plan. That would be a very good thing to say in response if they say no, not now. But just understand the difference there.
You are also welcome to direct them to the senior housing vaccine at mass.gov. And we will confirm if they want to check with their DPH representative, if they want somebody besides you telling you that yes, there'll be vaccine, they're welcome to do that due diligence.
And I would say that, you know, not every community is set up to do vaccines. So if you've spoken to the health department and they've indicated that they aren't able to do it, not just because of a vaccine that's available to them, but because they're doing a lot of other work related to responding to the pandemic, then it just necessitates a conversation, perhaps with Emily's assistance, to find a different partner.
You know, thank you for those answers. So we had a question from a gentleman named Paul Stelzer, and it asked if we have a vaccination partner who is willing to do all of our properties, but one site is still on the FPP list. Should we wait for, you know, a HUD 202, you know, should they wait for that provider or schedule, since that seems to be going very slowly?
Let's see, this is being recorded, right? I think what I would say is I would play both of them out until we're activated and see which you can get first. It depends, Paul. I know it depends on if you have CVS or Walgreens. I think it's going to depend on when the governor activates things. So there's a lot of timing, and I think we have two unknowns with the timing right now. So what I would say is I wouldn't pull out of the FPPP program until you have something else lined up that you think is going to be earlier. And I think that's actually fine. And CVS, you know, you can always cancel at the last minute if that's what happens, because you get activated and this other partner can do it quicker.
Thank you. So we just had a number of questions just kind of on kind of that dance partner subject, and whether there's a list of kind of vendors or entities, like ambulance companies like Cataldo, or pharmacies or hospitals, healthcare centers, whoever's doing it, supermarkets. Is there a list somewhere of kind of the type of partners that kind of are out there that the state has to provide? I mean, especially just because, regionally, a lot of folks will be looking for, partners that work for their area, and it could seem helpful if you knew or had that to hand.
Sure. I mean, so what I email back to people, first of all, I just look at Mass Community Health Center and find your community health center, because I don't know which ones are where. So I always start there, and I start with the local Board of Health, and I look to the local hospital. So those are kind of my three things. I do have access to, for example, Hannaford's and Stop and Shop and Osco and things like that. They don't want me to give out their number. They'd rather be called on as needed. Same thing with independent pharmacies. They're a little worried about being flooded with requests. So I would say, if you don't mind, just emailing me and I will put you in touch. We've also got other work streams that happened earlier where they did homeless shelters and group homes and things like that. And we've kept a list of those local pharmacies that were involved in that. And I look geographically. I spend a lot of time saying what towns surround, Winchendon, and try and make matches. So, I would try with the basic ones and then just email me. Don't worry about it. And don't worry about asking me. I live to work. It's fine.
You might have a full inbox there.
That's fine. That's fine.
But yeah, so there was a number of questions about there was one question we had about like a link to the consent form. I think that was mentioned.
So I think depending on who your dance partner is, you're going to have a different consent form.
Okay.
So that's what I would say is to the person that you're partnering with, Board of Health or CVS or Osco or Keys Drug or whatever it is, what do you guys need? And they might not even, they may say, well, we need some sort of consent form. And we can actually, if they don't have one, we can probably get you a sample that might be, usable. But in most cases, they already have some paperwork they need to complete. And so just getting from them what that paperwork is so that you don't have to do it the day of when people check in, and you can do it beforehand, especially if you need to work with people who need it translated into different languages.
Yeah, thank you. And I guess, I think you had spoken to the kind of timing of this, and obviously it's still rather fluid, but we did have a couple questions just about when you think the button might be pushed or you will be activated.
Your guess is as good as mine. I have no idea. I got nothing. Anybody on the phone? We could do, an over under on it. I have no idea.
Well, I think it's all related to supply. And you listen carefully and you understand what's happening with supply, and we'll get a sense. Right now, things feel very constrained. We all expect that to ease up in the not too distant future.
Thank you. Yeah, I mean, so one question also was just about will the proximity of mass sites and regional sites be factored into whether or not allocations will be made to senior or affordable housing authorities? Is that
no, I think what'll be factored in the most is what the agency has on hand. There's this really, really large spreadsheet that is so large it takes 5 minutes to open, and it has everybody, and it has what they've requested, and it has what they have in there and then they have much of that was distributed. And actually, they if you're asking for more, you need to have either spent what you have or have a plan for spending it tomorrow. And I think that's going to play the biggest role. So that and the fact that we are doing our forecasting, we have looked at those planning surveys that the housing agency submits and said, this is what we envision we're going to need for the next 3 or 4 weeks as far as vaccine allocation. So, so we will start, if we get to sort of where we're supposed to be for that week, we might say to you, you know what, do that. We're going to have to move you into the next week. But mostly it's been, about what you have in your hand, and also kind of what the state is prioritizing. They're going to prioritize the second doses, for example, over your request for the first doses.
Yeah, and I mean, I think you've spoken to this, but just on the process by which, communities or senior housing sites need to send you a survey, basically they need to get in touch with you to ask for what they need. And that's something, that process can start before you're actually activated, or is that only something that can be?
Yeah, so Mark, and I want to parse what you said. They have to submit a survey to tell me what they're going to do. They don't ask me for anything. I just need to know you found your dance partner and this is what we want to do. And here's the information about that dance partner and blah, blah, blah. And we're going to do an on-site clinic and we think they're going to be 200 people and we'd love to do it on these days or whatever. I just need information about who you've partnered with. And I need that as soon as you have that information. Because that way, if you wait until the last minute, we have 180 people already submitting this, and we're trying to balance the demand with what's available with the supply.
Emily, can I add to that?
Yeah.
Maybe to help? So there's two surveys, right? So there's the survey that tells Emily and Robin who your dance partner is. Who is the provider that you're working with? That helps us to understand. It also flags for the command center that when a request comes in for a community health center or a local health department for a larger amount of vaccine that week, we can say, oh, look, this is set aside to, specifically to help vaccinate the residents of this particular housing facility. So like it's a way for us to understand what's going on out there so that it isn't automatically so it is less at risk for being cut, right? So if there's a demand issue, we know where these things are coming from. Then there's the weekly survey, and it's unfortunate that there's so many surveys, but there's this weekly MCVP survey. That's how people order vaccine. So don't confuse the two of them. There's the one to let people know where, what the plans are. And then there's the one that's actually done in order to order vaccine. And we'll refer to both of them as this housing agency group opens up. So when we know that somebody's partnering, we can make sure that there's the vaccine available subject to, overall availability.
Thanks, Jana. That's really helpful. And I'm thinking maybe I should share my screen because 2 surveys for 2 different groups. It's a marriage, right? So we have the housing agency, they complete 1 survey as soon as they find their dance partner, which I think if I can share my screen, Sasha, is that okay? I can show you where to do that. And then the partner agency is the vaccinating agency, and they're going to submit a survey when it's time and when they can for vaccines. 2 partners, 2 different surveys. So I will show you where the planning survey is. Can you guys see that? Somebody gives me a thumbs up. Okay, so this is our website, and I mentioned we have a whole bunch of variety of things on here. I think the link is in the chat. And if you go to reporting, here is the planning survey, and you would complete this online survey here with a variety of stuff. And this is completed by the housing agency. It is not completed by the agency that is getting the vaccine allocation, which is the people who are putting shots in arms. So I hope that helps.
Yeah, no, I think that is really helpful. I mean, it does sound, in clarifying the kind of roles of the different partners. I mean, I guess, yeah, so somebody had kind of had a follow-up question, like if the municipality is unable to provide help and the senior housing agency needs to work with the private pharmacy, should they still complete Emily's survey? And I would probably say that, they should.
Yeah, the senior housing people complete the survey. Yep.
Yeah, so
and tell us that they're going to work with Metro West Pharmacy or something.
Right, whoever they're working
Metro
with,
West Pharmacy would order the vaccine when
it comes time.
No,
Mark,
thank you.
since you brought this up, I just want to offer one other suggestion, which is if you're in a sizable municipality, I don't know, I see I see somebody here from Salem. So if you're in a sizable location like that and you have a lot of senior housing, you may have more than one partner. You may decide to convene your friends from the health system, from the health center, from the local board of health, and from the local pharmacy and figure out a plan for the whole city. So you don't have to use just a single partner. In fact, in many cases, if you're a sizable municipality, you may be working with more than one, or you may luck out and there may be ABC health system down the road and says, do not worry, I got this, I will take care of this. So just be open to it coming from a couple of different places, depending on what your situation is.
Thanks, Robin. We probably have time for one more, but there was a question around, the methodology for parsing out the vaccine to those who have filled out the survey. Is there some, method that you'll be applying to, who gets it at what times? Or is it to do with like, when an agency is able to find a partner or anything like that?
So we're not going to, if Metro West Pharmacy, as an example, submits a request today and says, I want to do senior affordable housing, we're going to say no, because it's not activated. And if they submit it, in a week, let's say it's activated in 2 weeks and they submit it then, and I don't know anything about it, then we're going to say, no, we don't have it. We don't have anything from Framingham Housing Authority about it. Beyond that, it is a very sort of complicated discussion within DPH and across EHS to figure out across the various work streams, which include congregate care facilities and home health and boards of health and mass vaccination sites and senior affordable housing. There's got to be at least 10 or 15 different work streams, how we can figure out getting vaccine to everybody. So it kind of goes into this, it gets submitted at Tuesday at 5 p.m. and we notify you by Friday, and in between there's a lot of conversation.
Well, thanks for that. And just, for everybody, there were a few questions we didn't get to answer. We are going to, have a record of the chat, and we'll be able to supply, provide that to Emily and Robin and her colleagues, so they will be able to see that. One other thing, a general question was just, will the slides be made available? I've told people yes, hopefully I'm right about that, but I assume that's a yes. And other than that, I want to hand it back over to Mark Drazen for some closing remarks, and thank you all for joining.
Mark, thank you very much for fielding the questions, and to Sasha and Elise and Kasha for helping with the technical aspects of this. Jana, I'm particularly glad that you joined us. You're often in many of our calls with mayors and managers, so it's good to see you here today. I'm glad Emily and Robin made that last minute request and you were able to join us. And I want to thank Emily and Robin for running and giving us the opportunity with this somewhat complicated, admittedly challenging program, but one that's going to serve, I think, thousands, maybe tens of thousands of seniors who really need this help. I want to just close with an observation that, there are some communities with maybe 1 or 2 senior housing complexes, and the owners and operators got it. And then there are other communities with 15, 20, 25. They're owned by different people. The housing authority owns 5 or 6. There's a lot of demand and maybe a limited number of partners, or you don't know exactly who the partners are. In those cases, the municipality, probably the local board of health, but it might be someone else in the municipality, has a real opportunity to convene those folks, to try and make sure they know about this program and understand what's going on, to make sure that those people can ask questions of Robin and Emily and Jana and others on the state level and get their questions answered, to help find one, or as Robin said, more than one medical partners, and then to get those planning surveys filled out for the individual buildings and submitted. That's the first step in the process. If you can help people over that threshold and begin to do the planning in the individual buildings, so there are places where people can be vaccinated, and so the consent forms are filled out, then you're going to be ready to go when that date comes. You'll be ready if that date comes on the 22nd of February, or you'll be ready if that date comes on the 10th of March. And so I would really close with some encouragement to the local officials on the call to help play that coordinating role, help be the traffic cop, help get the questions answered, help find the medical partners, especially if you're in a community where the individual building operators might not be in a situation where they can easily handle that on their own. So with that, I want to thank everybody for participating, especially Emily, who's doing such a great job at running this effort. And if there are further questions, please ask MAPC. We'll put you in touch with the right person, or even better, just use the website and the email address that Emily has provided. I know they'll try and provide you with answers. Thank you all very, very much.
Thank you.